Thank you for the introduction, and thank you guys for coming. It really is an honor and a joy to get to share a little bit of my work with you guys, and I'm sure everybody can relate a little bit. You get so sucked into your hole and your world and in your head that coming out of it and sharing it with others sometimes is a little bit daunting, but exciting too. It's like, I kind of do have a story to share, and I think it's kind of interesting, and so just grateful for the opportunity to get to do that. So thank you very much. Just to give me a sense, I've met some of you. The others are PhD students, master's students.
A few undergrads.
A mix, a few undergrad. Wonderful, wonderful. Well, welcome everybody. As I progress through this talk, please interrupt me with questions as you come. I'm happy to be informal in this and let it be whatever you need it to be to get as much information out of it as possible. And I'm told I'm supposed to stay kind of within these boundaries, so I'll try not to walk around too much. All right, let's see, here we go. A little bit of context for my research. As Johanna said, I have 11 years of experience as a speech-language pathologist, and have really enjoyed getting to take some of my observations and interests from the clinical realm and apply the research component to that. And so much of what we're going to talk about today is founded from instances and children that I experienced and worked with in my clinical realm, and especially working with the preschool group when I was here at UT Dallas. There just became more and more times where the families that graduated and the children that graduated gave us feedback that it wasn't even so much the language per se that was making a difference as they transitioned into kindergarten, but rather that amorphous thing of being able to do school. You know, the ones that could come in and sit and they knew where to put their backpack and they knew how to stand in line and walk down the hall and they knew how to kind of act in centers and what to do during story time. Those teachers seemed pretty amenable to working on the nuances of the language per se. The grammar skills, the vocabulary, all of that, they weren't too intimidated by it. But it was the kids that had the language problems plus really struggled with that transition that seemed to struggle the most. And so we had the opportunity from the clinical perspective of trying to work on this thing that honestly as a clinician I didn't have a name for. But it was those skills that seemed to enable children to successfully transition from our program into kindergarten, into formal schooling. And so, wrong way. As I began my PhD career, started finding out terms for this. So the first term we'll talk about is this idea of school readiness. So the idea that a child is or is not prepared to navigate that transition into formal schooling. And so one definition we might consider with that is a child's minimum developmental level across a range of constructs necessary to succeed in this academic realm. So let's dive in a little bit more. The notion of school readiness really is situated within an ecological model from a theoretical standpoint. The idea that children don't function in a bubble. They bring a host of skills to a particular environment. They bring their language abilities, they bring their IQ, they bring their home environment, the experiences to date. They bring their self-regulation and behavior regulation that we're going to talk about today. But then they bring that within contexts and environments that require different things of them. Home requires different aspects of their abilities than school. School, they have a variety of contexts. They have a classroom setting, they have a therapy setting, they have the library and recess and all of these different environments that the child uses his or her skills to influence the environment, but the environment also influences the child. And so it's really this notion of this bi-directional influence between the child and the child's environment that creates the situation of what we're calling school readiness. Is the environment ready for the child, and is the child ready for that environment? So to get more specific into my world, this theoretical view is the basis really for my line of research. And to date I've investigated several different, we've got all kinds of fun things going on. All right, let's see here. All right, we'll start here then. So investigating aspects of that classroom. So the classroom being one environment. And we're going to talk about a study that I did early on in my PhD program that looked at components of the classroom that might influence success for the child. Aspects of the child is really where we're going to hang out the most today. But looking at social behavioral competence and acknowledging the fact that their language skills and their pre-academic skills certainly influence the way in which they're able to access and perform in that academic environment. But looking more specifically at that social behavioral competence piece. And then obviously speech-language therapy for our kids with language disorders or language impairment is a unique environment in the school system for them, but one that is important and one that we know some about, but as a whole context and from an environmental perspective rather than a therapeutic standpoint, we still have a lot to learn about what's going on in that environment. So know that from my perspective, this is kind of who I am in a bubble. But for today, I'd like to focus on the research that pertains specifically to the child and how that child then is able to navigate that world. Okay, so why school readiness? When we think about things that the child brings to the table, we have their language skills, and as speech pathologists and psychologists and even audiologists, we understand that, right? That language is important for learning. And we understand that pre-academics are emergent literacy skills, early math skills, early writing. All of those play a piece into a child being able to successfully do school. But then there's this component of social behavioral mechanisms that we're learning from the typically developing children that it also plays a role in school readiness and a child being able to show up to a formal education and access instruction. And the reason we even are caring about school readiness is that much research has shown a connection between a child who is ready to do school and brings those traits to that academic environment has better long-term academic success than someone who doesn't have that same level of school readiness. So when we talk about social behavioral competence, there are so many terms that we can use to describe, and it's really a fuzzy construct, for lack of a better term. And I think there's something about those fuzzy constructs that just appeal to me. I don't know why. It's almost sadistic, right? But let's identify something that you can't really name, and it's hard to measure, and it's hard to pin down. But that's reality for our kids. That's the world they're in. And so to get to try to describe it, define it, and figure out what's working behind it, it's kind of interesting. So one of those aspects of social behavioral competence we're going to talk about today is behavior regulation. So here's how I situate behavior regulation. And again, know that you will hear so many different terms. You'll hear people talk about it in terms of self-regulation. And that is one way that I understand behavior regulation. It's more the external or behavioral manifestation of a child's self-regulatory system. It looks like these are a little bit hard to see, but theoretically, self-regulation might be conceptualized as the two different components. That of the neurological system, meaning it's the malleable aspect of someone's self-regulation that can be changed. It can be targeted. It can be manipulated to be improved or to worsen, as the case may be, as opposed to more the biological side. You'll hear people term this temperament, which refers to a child's shyness or their surgency or their ability to just regulate their emotions in a particular situation. And the fact that it's biological, some researchers would argue means that it's less amenable to being taught or any kind of treatment approach. But that is a very, very, very theoretical conversation and one that there's much debate out. So we're not going to debate those constructs today, but know that there is much debate, and that for the research that we're going to talk about today, the behavior regulation that I'm referring to is situated under this neurological standpoint, but one aspect of the child's self-regulation. Does that much make some sense? Awesome. All right, so let's dig deeper then. We have behavior regulation under this idea of self-regulation, but specifically by behavior regulation, I'm referring to a child's ability to adjust his or her behavior to meet the demands of whatever the environment is requesting. So a child's ability to remember and follow through with the instructions, whether the instructions are when you're finished playing in blocks, you need to clean up and then go sit down on your square. Or maybe it's when you come in the mornings, you're supposed to put your backpack in your cubby and get your sheets out of your folder and go sit and start working independently. Maybe it's a new direction, something that's novel for that particular day. A child's ability to persist towards goals, so that when things get hard, do they stick with it and see it through, or are they willing at that point to just leave and discontinue their attention in that particular activity? Inhibiting their preferred or desired actions in favor of what's required. So this could be all kinds of things. Maybe this is remembering to raise their hand when they have something to say rather than just blurting it out. Maybe this is not running down the hallway when you see your mom, even though that's really what you want to be doing at the time. Even inhibiting things like being able to stop what you're doing and clean up when you're not finished yet. And you would rather see it through. You would rather keep on coloring, but you can't. And you have to inhibit what you would prefer to do to keep doing what you have to do. And as adults, we have to do this all the time, right? We don't get to always do what we want to do. We have to inhibit what might be going on in our heads in favor of what the socially accepted norms are. And then directing motor actions as well. So if somebody's right beside you, not just shoving them, but using words or tolerating other people's presence. So then a child who has low behavior regulation might be seen to be very reactive, attention-wise. Somebody walks in the door, they're going to look, they're going to want to pay attention, they're going to want to hear. Very spontaneous. A thought pops in their head, it's going to come out their mouth, or going to come out in their physical actions. Things are happening very immediate. Versus children who have high behavior regulation have more focused attention, more deliberate actions, and more of an internalized register going on. All right, so then why do we care? If we're thinking about school readiness and we're talking about a child's self-regulation system, how does that connect? This again is somewhat theoretical, except that Rem Kaufman and colleagues looked at what this might look like in a kindergarten classroom. So they surveyed over 10,000 kindergarten teachers and asked them, when you get a new bunch of kiddos in the fall, what do they struggle with the most? And so these are the percentages of teachers who said that half of their class or more struggled with the following abilities. So being able to follow directions, lacking academic skills, being able to work independently, and even difficulty working as part of a group. And so what's important about this is that these are typically developing kids in with a mix of kids who have language difficulties as well. But what's fascinating to me about these percentages is that we know children with language impairment to be at additional risk for challenges in the classroom setting. And so to know that they already have that risk factor or going into a situation that's challenging for even typically developing kids really raises that importance and awareness when it comes to our language perspective. All right. So then when we look at then how behavior regulation might manifest itself in the classroom. From a theoretical standpoint, children who have high behavior regulation, we might say, can access instruction. Right, so behavior regulation isn't thought to be the actual mechanism in which children learn, but rather the mechanism that allows them to access the point of instruction. So accessing what teachers are teaching, accessing what the therapist is providing in a therapy situation. So being able to ignore distractions, being able to identify where is the meaningful information coming from right now and where do I need to direct my attention so that they can then glean that information from the teacher or therapist. And those then who have high behavior regulation can spend more time on learning. The teacher isn't having to redirect, not having to repeat directions, not having to get everybody back together. More time can be focused on the learning, and then in theory, the more time spent on learning, the better the outcomes. In contrast then, someone with low behavior regulation isn't ready to learn yet. They're still trying to figure out, where am I supposed to pay attention? What are the rules? What am I supposed to be doing with my body, with my mind, and with my peers right now? And so as a as an influence, then they're more distracted, not ready to learn, and more time is spent on redirecting and reminding rather than the instructional piece. Okay, so that's more the theoretical frame of why would it matter that we spend time thinking about a child's behavior regulation in terms of learning. Okay, so there's actually been quite a bit of research done for typically developing kids on this connection between behavior regulation and outcomes. And so some of what I learned going through the literature review, we know that behavior regulation is associated with child development across a myriad of academic constructs, math and reading and writing and even language for typically developing kids. There's also been a host of studies that looked at that interaction, just like that ecological model we started with, between a child's behavior regulation and that of their environment. That it's not a unidimensional construct, but rather that aspects of that environment interact with the child's behavior regulation to influence outcomes. We know children with language impairment to be at risk for low behavior regulation, but that's about all we know at this point anyway, with the connection between behavior regulation and this population of children. And we know that children with language impairment find themselves in lots of these environments. So we know from the typically developing literature that there seems to be this connection, but how that plays out for our children with language impairment is less understood. And so that's really what brought me to my preliminary research interests, is identifying this gap in understanding how the behavior regulation interacted for children who are at risk for language impairment, how it interacts for children who do have language impairment, and then what is that interaction piece between the behavior regulation and the different environments that children with language impairment find themselves in. Okay, so all that background, and thank you for hanging with me during that long introduction, but behavior regulation is such a fuzzy construct that I wanted to make sure we were all thinking and talking about the same thing before I dove into the research component. So let's shift gears in a little bit. I conducted 3 studies to date around this notion of behavior regulation, children who are at risk for and currently diagnosed with language impairment, and the environments they find themselves in. And so I'd like to take us through each of those studies. Again, I invite questions as we go, and then end with the study I'm currently working on. All right, so the very first study, published in 2012, looked at the relationship between teacher-child relationships as an aspect of the environment, the classroom environment, and behavior regulation for at-risk preschoolers. So these are children who have not yet been diagnosed with language impairment, and several of them will go on to not have a language impairment, but either because of their socioeconomic status or aspects of their birth or aspects of their pre-academic skills are at risk for having continued language delays. So I asked 3 questions from that background knowledge and the gaps identified. Specifically, understanding to what extent the teacher-child relationship predicted outcomes for these preschoolers, to understand how behavior regulation predicted outcomes, and then to see to what extent there was a moderating effect between those two. So to investigate those questions, I used an existing database, a larger scale study of preschoolers in identified target enrollment Head Start centers over the Midwest states of the United States, and pulled 173 preschoolers with a mean age of 52. To be able to answer these questions, those children in the larger study were given the self-preschool, the core language subtests in the fall and spring of the academic year in which they participated. The teacher completed the STRS, which is a student-teacher relationship scale. They're given statements and asked to rate how much it applies to their relationship with their child on a scale of 1 to 5. And then for the behavior regulation, the teachers also completed the CBQ, which is a child behavior questionnaire. There's been a lot of uses of the CBQ. The nice thing about this questionnaire is that anyone can complete it. Teachers, parents, practitioners, anyone with knowledge of the child can complete this form. There are aspects of the child behavior questionnaire that tap into temperament. You know, we talked about initially the self-regulation pieces that split off, but there are subcategories of the CBQ that tap into more of the behavior regulation components, more of a child's attention, more of a child's inhibitory control. And so it was those specific questions that we pulled for this particular study.
Beth, could you give just an example? Oh, are you going to tell us about the student-teacher rating form, the kinds of questions?
Oh, thank you for asking that. No, I don't have a slide about it. These are things like the child will come ask me for help. I have a positive regard when thinking about this child. There's a lot of animosity between. Okay. So it taps more into the emotional component. Is there a connection? And or what kind of a connection? Is this more positive or negative? Great question, thank you. And then on the CBQ side, a total of 36 statements, but again, I extracted 6. And where the STRS has teachers rate their relationship on a scale of 1 to 5, the CBQ is a scale of 1 to 7, with 1 being extremely untrue, 7 being extremely true of the child. And so then in contrast, or in extension rather, children who have lower overall average scores are said to then have lower behavior regulation. And then the higher their score on that scale of 1 to 7, the higher the behavior regulation. So here's some example statements that the adults would complete. That the child will move from one task to another without completing any of them. And some of these statements then would be reverse scored. I should say that as well. When drawing or coloring in a book, they show strong concentration. They're good at following instructions. The child will approach places he or she has been told are dangerous, slowly and cautiously. Some people are laughing. I think of specific kids in my head when we're reading these statements. You too? Yep. And that's what's so interesting to me about behavior regulation, right? You start learning more about it. It's like, I've seen this. I've seen this play out with lots of kids, and I have some adult friends that kind of fit into some of these categories. Okay, so then what did we find? For the first research question of the connection between teacher-child relationships and gain, we found a significant positive relationship. And for language, I should say on this, we specifically looked at their grammar ability. So the better the teacher-child relationship, the better their grammatical outcomes at the end of the year. And that's what was interesting to me about this, is that we didn't look at the curriculum. Right? It was business as usual for these preschool teachers, regardless of what was happening academically. The stronger that positive relationship, the better the outcome. In terms of behavior regulation, there was a trend. So we had a p-value of 0.057, but not overly significant compared to some of the background research. But we did find an interaction. And so let's look at what this interaction showed. Yes. Excellent. So a little bit of orientation to this graph. Along the x-axis, you have one aspect of the teacher-child relationship, and that of conflict. So 1 being low conflict, 3 being average conflict, and 5 being high on that scale of 1 to 5. On the y-axis, then, you have spring language scores, and these, I believe, were raw. They were raw score composites between 2 different subtests. And then each of the 3 lines represents a different level of behavior regulation. So we have our blue dots, our children with low behavior regulation, our red dots, children with about average, and the green solid line are children with strong or high behavior regulation. And so if you'll focus your attention on this end of the interaction or this end of the graph, what you notice is that for children who find themselves in classrooms with high conflict between themselves and the classroom teacher, behavior regulation seems to exert a sort of protective mechanism. So in other words, children who have high behavior regulation in high conflictual classrooms do better over an academic year than children in the exact same classroom who have low behavior regulation. And so just starting to see this interaction between, it's not just the child's ability on the table, but that interaction between the child and his or her environment that seems to exert some influence on their language outcomes. Get through these. Yeah. Okay, Okay, so then bringing together for that first study, we learned that children with at risk for language impairment, let me say that a different way. We know that children with language impairment are at risk for low behavior regulation, and we know that behavior regulation interacted with aspects of the environment to influence language outcomes. And that for children with language impairment, they not only find themselves in a classroom, but also find themselves in a therapy environment. And so what kind of interaction might we expect in those situations? And so based on that background knowledge and learning about the interaction between those constructs for children at risk for language impairment, I was interested to know, does that relationship hold for children who've been diagnosed with a language impairment? And does that relationship hold within the therapy session itself as one of the environments for the kids? So, to answer those burning questions, the second study published in 2014 was vocabulary gain among children with language disorders, contributions of their behavior regulation, and emotionally supportive environments. So let's dig into this study. 3 aims that you'll notice look very similar to the first study. So the first one, to what extent does behavior regulation predict language gain? And for this study, I looked at vocabulary. The second question, to what extent does emotional support within a therapy session? So we're going to conceptualize it a little bit differently than the teacher-child relationship, but capturing emotional support, and I'll talk a little bit about how this was measured here in just a minute. And then the interaction between the two. So to do this study, children and the speech-language pathologists came from a larger study investigating speech-language therapy experiences in the public schools for kindergarten and first grade students. And similar to the preschoolers for the first study, what's really important to understand about this larger federal study was that the SLPs weren't asked to do anything different therapeutically. The intent of this study was really to get a snapshot of business as usual practices for children with language impairment who were being served in the public schools, who were receiving services from their speech pathologists. So as a result, we had a wonderful heterogeneous population of kids, all with the same diagnosis, but manifesting themselves very differently. And the SLPs were asked to just do therapy as usual, but let us come in and get a snapshot of what's going on. So the measures used, the Woodcock-Johnson picture vocabulary. The children were assessed in the fall and spring of the academic year in which they participated and assessed from researchers. So it was important to us that the language tests weren't extracted from their assessment at schools and also weren't used to influence any of the service provision they received at the schools. Behavior regulation was captured again by the CBQ, but this time the parents completed that measure for us. And emotional quality we captured with class. Is that a measure you guys are familiar with? Bob Pianta out of the University of Virginia fashioned this direct observation as a way to capture different components of a particular classroom environment's quality. So the emotional quality might be that warmth and positive regard experience between a teacher and the peers. And this is that it factor. Have you guys ever been in a classroom where you just kind of want to hang out for a while? You know, it's fun to be there, everybody's laughing, smiling, like it just feels good. And then in contrast, the classrooms where you just kind of can't wait to get out of there. Even as adults, right, there's different environments. And so the emotional quality captures that, regardless of the instructional quality and the language quality and the dynamic. Just, is it a warm, safe environment for kids to be? And so that was evaluated from the therapist's perspective. So we had videotaped therapy sessions from the SLPs with their kids. And so we went back in and watched the videos and evaluated emotional quality. Emotional quality, very similar to the behavior regulation CBQ scale, is rated on a scale of 1 to 7, with 1 being very low quality of emotional support, 7 being very high. So one of my research questions actually wasn't the descriptive component, but there's an aspect of the descriptive piece that I found very interesting. So we know children with language impairment to be at risk for low behavior regulation, right? Like that's been established. But what I found interesting was the vast range of behavior regulation abilities for children who have that diagnosis and are being served. So in other words, much like reading disorders or much like academics, children with language impairment may be at risk for low behavior regulation, but the reality shows that there's quite a range. So in other words, some children with language impairment are doing quite well with their behavior regulation, where others are struggling quite a lot. And so what that, just especially as a researcher interested in this construct, is a real positive finding because it suggests there's something here to measure. Right? If everybody with language impairment had low behavior regulation, well, the story's done. It's confounded with language and we move on. But there's something going on here. All right, so this is a very fancy chart of HLM. Because the kids were being seen in groups of 3 to 5 per SLP, they weren't completely independent. And so to account for that in our statistical analyses, I use HLM, or hierarchical linear modeling. Hierarchical linear modeling is regression, but it allows for allows me to capture the fact that the kids aren't independent, and to account for the fact that they're nested within SLPs. And so let's take each question at a time. So we have the question of behavior regulation. On average, children gained about 4, and these were raw scores, simple gain points, controlling for fall, from fall to spring. And as you'll see, children who had higher behavior regulation fared better, showed greater gains in their vocabulary over the academic year than children with low behavior regulation. And so how this translates is that for every increase in a child's behavior regulation score, their vocabulary gain increased by 0.5 raw score points over the academic year. And that doesn't sound like a whole lot, but when you're talking about gain for children with language impairment and looking at it statistically, behavior regulation accounted for 9% of the variance in children's outcome, and that's in business as usual situations. So with whatever therapy they were getting, whatever academics were going on in the classroom, behavior regulation exerted an additional percentage of that variance that we could explain. Emotional support was not a significant predictor, and this interaction term was not significant either. Any questions on that study? Okay, so then bringing it back together, then this is what I learned. That behavior regulation seems to relate to language outcomes for children in the public schools who currently have a language impairment and are receiving services, but that the quality of the therapy session wasn't a significant factor, at least in this study. There's lots of hypotheses as to why, and that'll be an interesting exploration for another time. But that left me curious again. So the behavior regulation we captured from parents' perspective. I wanted to know, could we actually document children's manifestation of their behavior regulation during therapy sessions in the form of engagement? So could we look at these therapy sessions and actually capture how engaged children were? And does that engagement then relate to their language outcomes at the end of the year? And the quality of the therapy session wasn't a significant factor, but we just looked at the emotional component. And so one of our theories is that SLPs, by and large, like to be there. They like the kids. They like interacting. And so maybe there wasn't enough variance in emotional quality to actually capture anything interesting. But what if we looked at something that would vary, such as the dosing of the amount of treatment that children got? That's another aspect of their environment. Do we see an interaction between behavior regulation and more therapeutic components of therapy sessions for children with language impairment? Okay, so then here's the study question. What is the role of engagement in language therapy for children with language impairment? And this study was funded by the American Speech and Hearing Foundation. So very grateful for those funds to allow me to dig in and look at this construct a little bit more. Okay, so I've already said those two specific aims. To what extent does engagement predict gain? And then to what extent does treatment dose moderate that relationship? Okay, so we're still back to the using the larger population of students and SLPs from our federal study of business as usual practices in the public schools. I randomly chose 2 students per SLP, so for a total of approximately 137 students who just had language impairment. So I controlled for comorbid diagnoses, controlled for those who just had speech, so could really narrow in on language. And then here were the measures. So for this, I used the 4 core language subtests of the self. For engagement, coded with 2 rock star undergrad speech language pathology students, 278 therapy videos for engagement. And so to do that modified coding scheme from Sarah Kaufman, that she developed a coding scheme to tap into literacy engagement in the public schools during storybook reading time. And so we adapted that to make it applicable for speech therapy, and I'll show you that in just a minute. But that actual variable was the number of active intervals, and every interval was 15 seconds in which the child was actively engaged. And so we'll look at those definitions. And then dose, those same videos we coded using the language intervention observation scale that allowed us to capture moment by moment exactly what was happening in a therapy session at a given period of time. And because of that coding scheme and the software used, we were able to extract the time. So maybe it was a 30-minute session, but out of that 30 minutes, how much of the time was actively spent focused on language, not playing the game, not going to the restroom, not getting set up, but just on target. Okay, so here's some definitions for engagement. We were going to capture aspects of the actual treatment with dose. So it was important to me that our engagement just looked at that, not confounded with the actual components of the therapy. So we defined off-task then as any child who was uninvolved. They may or may not have been disruptive, but they were disconnected, looking at the wall, looking at the floor, playing with something that was not the focus of the therapy session at that moment in time. Passive we called active listening, and we decided to do this pretty much because it was impossible to look inside their heads and know really where they were focused. And so we allowed for that with that code of passive engagement. They were there, eye contact was good, they seemed for all intents and purposes to be paying attention, is really what that code is. Intermittent was that in-between stage, and then active where they were either verbally or non-verbally involved in doing something in the therapy session. Accuracy didn't influence it. So if they were answering a question and they were wrong, that was fine. They were still actively participating in the directed activity at that moment in time. And then not applicable was the code for if the child was out of view or left the room for whatever reason. Okay, so this was a mutually exclusive framework. Only one could be identified in any 15-second interval, but the entire therapy session was coded for engagement for each child for 2 therapy sessions, and then averaged across. And then I already described dose. So literally we input the therapy video, and again, rockstar undergrad coders watch and moment by moment identify that's grammar, that's vocabulary, and with every language target identify what strategy. That was a closed procedure, that was a phonemic cue, that was a leading question, that was a leading statement, and extract time spent using those therapy strategies to capture dose. Okay, so here was the averages, and I was really interested in this idea of active engagement. So theoretically, it made sense that if children were actively engaged in therapy, similar to behavior regulation in the classroom, that they could tap into the important part of therapy, that being the intervention itself. And so as you can see, of the children, they had an average number of intervals that they were actively participating of about 12. Average dose of 11 minutes, focused on language therapy for a range of up to 23 minutes, that is. Okay, so it's a similar structure to that second research question where all this was run in HLM because the kids were nested within their speech language pathologist. Language gain, This is a z-score composite, so you can interpret these as standard deviations, but it was using all four
Average dose
core
within
tests.
which size sample? 11 minutes within which size sample?
Oh, good question.
Yeah.
So yeah, all 135,
So
and
about
then
10,
yeah,
okay.
so about right. So
Okay.
on average, and I don't think
Okay.
this represents it. The average therapy
Yeah.
session was about 27 minutes.
Okay.
So on average, children with language impairment were receiving intense language therapy for about half of their
Okay,
therapy
that was
sessions.
there. Okay, thank you. I'm sorry.
Yeah, no, great question. Thank you. Does that clarify it?
Yeah.
Okay. Okay, so then language gain, like I said, is the 4 subtests of the self, and I created a z-score composite. So this can be read as standard deviation. So on average, children with language impairment were gaining about half a standard deviation in their language ability from fall to spring. Engagement significantly predicted language gain over and above the average. So the way to read this is that for every interval, so every 15-second interval that the child was actively engaged, their average language gain increased by 0.03 standard deviations above the mean. So that doesn't sound like a whole lot, but it's 15 seconds, right? So you extrapolate that out for every minute of added active engagement, the child's standard deviation of gain increases by 0.12. You do that for another 8 minutes, you get 1 standard deviation improvement over the average. That's significant. And it's interesting to see it play out. I was talking to somebody at ASHA that this is kind of a no-dust study, really, right? Like when you start thinking about it, it's like, okay, if you're engaged in the therapeutic component, then you do better. But no one's actually looked at it. And so to see that over and above the therapeutic component of therapy, how much children are tapping into that matters, and it matters quite a lot. Dose was not a significant predictor, and the interaction term was not a significant predictor in this study. So then bringing it all back together, we understand that behavior regulation relates to language outcomes for children with language impairment, that engagement as a manifestation of that behavior regulation seems to matter, and that preliminary interventions, when you look at behavior regulation for typically developing children, seem to have positive effects on boosting the behavior regulation of children that have lower skill sets. So then that's my next question. So it seems to be this pattern of behavior regulation associated with outcomes, but all of my studies to date have been correlational in design. They're observations of what's going on, business as usual practice. Can we actually manipulate that behavior regulation? Is it trainable specifically for children with language impairment? And so that's the grant that I received and I'm actively working on right now, is a feasibility study to pilot an intervention for preschoolers with language impairment specifically geared towards their behavior regulation. So the aims of that study are to identify the feasibility of the intervention aimed at improving their inhibitory control, their attention, and their memory, and then to see if we get subsequent effects from that behavior regulation intervention on their language outcomes over an academic year. So similar to the correlational design where we're not going to ask the SLPs to do anything different, I'll be conducting the behavior regulation intervention so that we can see, in addition to what they're getting from their language intervention and from their classrooms, can we improve those behavior regulation effects. And I talked about all of this as my line of research, but I have a host of colleagues and supporters and grants that have funded this work and made it possible. And I keep bragging on my undergrads. Truly, I cannot brag on them enough, and I'm excited for our profession that they are going to be going out there, whether it's as clinicians or researchers or what, and using the knowledge that they've gained. So that's my presentation. So thank you.